You cannot clean the womb. You can't reach there.
All right. So, Nurse Ndi Nne, we'd like you to tell us about the common barriers of conception.
For pregnancy to happen, that means your brain has to tell your ovaries to mature and release eggs, and those eggs have to travel and meet a sperm cell. So if anything comes in between any of this process, then we'll start talking about infertility. And there are so many factors that can come into play. Sometimes we know what causes it, sometimes we don't. Like smoking. I think smoking is a very common thing among the youths because a lot of people think it's just flavor. It's not going to cause anything. It can actually affect your fertility, both male and female. Smoking, abuse of alcohol, especially the popular shisha, because so many people go for it with the excuse of I don't take cigarettes. It's shisha that I take. That one is flavor. So that one is even worse than the cigarettes. Then malnutrition can also be a factor. Malnutrition can come from you not feeding well, you don't take balanced diets, or you are actually addicted to something that is affecting your nutrient levels. Miscalculation of your menstrual cycle, because so many people jump into conclusion that, oh, I'm fertile, I can't get pregnant, without even knowing that the problem is a very simple thing. They don't know how to calculate their menstrual cycle, so they're having intercourse at the wrong time. If you've been trying to get pregnant for 6 months and 1 year, and you've been, yes, I said if you've been trying to get pregnant and you've been trying for like 6 months to 1 year, you've been having unprotected intercourse and you've not gotten pregnant, before you start getting anxious and worried that, oh, I might be fertile, be sure that you were actually having the intercourse at the right time. Because a lot of people don't even know that. So many of us think that every woman has the 28-day cycle. And so everybody is now working with 28 days. Whereas all of us we are not 28 days. You may be working with 28, not even knowing that yours is 21. It's very short. So before, as they are waiting for time, the thing don't already pass. There is a safe period that some women have after their menses. They have like a resting period before they ovulate, and then they have another resting period before they menstruate again. It's not everybody that have that resting period. So most times, as you are thinking, okay, I'm resting now, your ovulation have started. Immediately you are ending your menses. You are already fertile, and you are still wasting time. So after 6 months and 1 year, you now be saying I'm infertile, whereas you are not infertile. You just don't know how to calculate. A lot of women don't know that baby they've been looking for, all they need to do is just to cut down on their workload. They'll get pregnant. Is that simple? Is that easy? Like very easy? Yes.
Just reducing your stress.
Your stress.
Wow.
If you know that you are the workaholic, you work, while you are just looking for a baby up and down, you are the reason why you've not gotten pregnant, because your hormones are fluctuating. That is why people like athletes who exercise to the extreme levels, their hormones fluctuate and it affects their fertilities. So if you wear your body out, your reproductive system will start dancing around. Hormonal imbalance is like a common one too. Sometimes it's something you can't control, like polycystic ovarian syndrome. You don't have a control over it. Although sometimes you can also have a control over it, because if you are obese, if you're of the big size and you don't make lifestyle changes to cut down on your weight, once obesity sets in, you will start having insulin resistance. So when your body is resisting the effects of insulin and you just have sugar gathering in your bloodstream, the next thing is to affect your hormones. Instead of your feminine reproductive hormones to be released more, you will start having more of androgens that will affect your ovaries, and cysts will start forming there, and before you know it, your menses is no longer regular, and so you can't track your ovulation to know when to get pregnant. Untreated infections, depending on the type of infections anyway. If someone has untreated sexually transmitted infections, If not handled on time, fertility can be affected. That is why I always tell people, if you are, because I know, yes, one of the ways of avoiding STDs is to have one sexual partners. But as you're having one sexual partner, be sure that your own partner is having only you. If not, you are still exposed to the danger. But if anything of that sort happens, then fertility can be affected because it can damage the reproductive organs. Then aside the sexually transmitted infections, there are so many practices that a lot of young women involve themselves in that actually predispose them to infections that will damage their reproductive system. It's actually as if it's trending. If you learn, you teach your friend and your sister. They will tell you things like using inserts. Insert yoni pills, insert this and insert that. Insert cloves, ginger, garlic. They say they want to cleanse. So all those inserts. It's just going to go and alter the pH balance of your vagina. It will no longer be acidic again. It will become alkaline. And once it is alkaline, everything can go in. Anything you pass, you catch it. Because the acidity is naturally meant to protect you from infection. Some do it after giving birth, some do it after their menses. They say they want to cleanse the womb of whatever that is left. You cannot clean the womb, you can't reach there. And the womb has a gate that closes after delivery or after menses. The cervix will close. So that your steam cannot reach the womb. It is the vagina that it will end in. That canal, it will end there. And just switch it from acidity to alkaline. So the person is now prone to vaginal infections.
From all you said, to link all what you've been saying, it has been very, very educative, I must say. And I would like to link it to our product, Pregnatab Conception. You know, it's a product that is a supplement, a prenatal supplement that for women who are trying for a baby. And it has several vitamins and minerals that help to ensure the woman conceives as much as possible. So can you just throw more light on it? You know, it has inositol, it has CoQ10, and acetylcysteine, and vitamins and minerals. So can you?
These ingredients actually help in maintaining the quality of your eggs, because age is a factor in fertility. Age is actually a huge factor, because if you are below 35, you can try for like a year before you start saying I'm infertile. But if you are above 35, from 6 months of trial, you start looking for help. So that is why Pregnatab contains ingredients like that coenzyme Q10 that helps to supplement, because the more you are aging, the one your body produces will reduce, and it will affect your ovarian reserve. So that is where Pregnatab comes in, to supplement, so that even if you are not ready to make a baby now, your eggs can stay in a good state, and also to maintain their quality. And you know that the more you're menstruating, your ovarian reserve is reducing, and you may be exposed to certain things without even knowing, and they'll be damaging the quality of the eggs, like radiation. So, but Pregnatab helps to maintain the quality of those eggs till when you want to use them. And it also increases your chances of implantation, fertilization happening. It increases the chances. And then the Pregnatab Original helps in pregnancy for the good development of your baby, and the mother too, for it to stay in good health. And you know that iron has a link to fertility. And if you're lacking iron, that means fertility will be affected. If you manage to get pregnant, the pregnancy can be affected too. You may lose it, or the baby will get deformed. But at least with Pregnatab that have a safe level of iron that you need, that means iron deficiency is out of the way.
So you are rest assured that you have all the necessary vitamins and minerals that you require, both for conception and even as soon as you get pregnant. So for inositol, just to buttress on what Nurse Ndi Nne has just said, for inositol, it helps to regulate the hormonal imbalances. Then for CoQ10, helps to it boosts the quality and the quantity of the eggs of the woman. and especially with age, as you are aging, like she rightly said. Therefore, N-acetylcysteine, it induces ovulation. That means you have to ensure that you are ovulating at the right time. From what Nurse Ndi Nne said, we all have different ovulation, we have different cycles and all that. So to wrap up this session, can you say something to listeners out there? You could just wrap it up by talking about menopause and fertility. I know that's another major issue out there.
Yeah. When menopause strikes, that means fertility is over. So it depends on the age when it starts. But normally, 45 to 50, menopause has started. Some people is always 50, but sometimes we give up to 45. But because of the fluctuations in our hormones now, especially with what we eat, and a lot of people now having premature menstruation, it now reduces the number of years they have to stay fertile. So menopause can now start as early as 40 or even 35. Yes, I've seen some women that started at 35. So that is why, if you know your family history, which they normally ask at the antenatal, you know how to plan yourself and start on time. Yes, at least Pregnatab is there to help, so that even if menopause will start too early or whenever it wants to start, your eggs will stay in a good state so that you can easily get pregnant.
Wow, thank you, Pregnatab Conception. That is a plus for our product. So you can hear that. Just go and grab your Pregnatab Conception, a pack of Pregnatab Conception, so that you don't have anything to worry about with that regard. Thank you so much, Nurse Ndi Nne. I've enjoyed every bit of the session. That's been very educative, and I'm sure our listeners out there too have learned so much. Do we have questions?
Somebody is asking me about boric acid. Me, I don't advise you use it. Me, I would advise you don't use it. If you have any vaginal infections or anything, go to the hospital. There are medications. Tests will be carried out. They will culture your discharge and know the medication it will be sensitive to.
Can someone with fibroid take Pregnatab Conception?
Yes, you can. You can actually get pregnant with fibroid. It depends on the size and location of the fibroid. There are a lot of women that have had their babies while still having fibroid. The only time we talk about surgically removing it is if it is standing in the way of taking in because of its location, or if it is causing miscarriages, because even if you take in, it's now dragging space with the baby inside the womb and causing deformities or miscarriages. So that is when we start talking about removing it. But if the location and the size is not bothering you, you can get pregnant with it. So Pregnatab will only back you up with helping with your fertility and taking care of you and your baby throughout the pregnancy. But it's not going to do anything to the fibroid. As long as the fibroid is not in the way, Pregnatab will do its job freely. Yeah.
That's a nice one. All right, we've come to the end of live session. I'm sure you learned a lot from our amiable Nurse Ndi Nne. Thank you so much for all the information and concerning conception. And see you next time for another exciting live session. Bye for now.